Hello, Dr. Myhill, and thank you so much for making the time to speak to me today. So today we'd like to explore the important area of boosting our immune health, and which approach you follow in achieving this in your patients. So you've prepared a few slides for us, which I'll bring up now. There you go, and I'll just remove myself and I'll let you go through the slides and I'll come back after.
Thank you. Okay, well, many people, when they come and see me, they want to have that one treatment, that one herb, that one supplement to boost the immune system. But it's not as simple as that. There's a delicate balance here, and the immune system can be overactive. And we see that with autoimmunity and allergy, where it's incorrectly programmed and firing off incorrectly, or it can be underactive because it's not dealing with infection well. So there's no one single solution to strengthening the immune system. It's always going to be a package of treatment. And next slide, please. The point here is that I can't tell the difference between the immune system and the brain. It's complicated. The brain is probably the single most complex thing, let's say, in the whole universe. It is quite extraordinary. And there's no one thing we can do to boost the brain or strengthen the brain. It's exactly the same with the immune system. And they're similar because they're responsive to hormones, neurotransmitters, electrical signals, and so on. Both are intelligent in decision making. Both are enormously demanding of energy and raw materials. So that is always the first thing to boost our brain and boost our immune system, is to have good energy delivery mechanisms and the raw materials they need to function. And I think there's another dimension here, which is that an angry brain makes for an angry immune system. A happy brain makes for a happy immune system, and a depressed brain makes for a depressed immune system. And there's so much literature there. Just the best example of that, for example, is if you have a loving couple living together, if one of them dies, then the risk of death in the one that remains is much higher for the next 12 months. So the point here is there is no one treatment to boost the immune system. It's always a package of treatment. Next slide, please, Linda. Okay, so what does the immune system need in order to fight infection? Because that is the single biggest challenge. All pathology has an infectious driver. When I was writing my book, The Infection Game, I researched it at some length. And with all dementias, with all cancers, with all heart disease and arteriosclerosis, there is often an underlying infection. Now, that's obviously often driven by sugars and carbohydrates, so that's another aspect of that. But life is all about keeping those infections at bay. And I think of this as life is an arms race. You and I are a free lunch for all these microbes which would love to make themselves at home in our extremely comfortable, warm, moist, well-fed bodies. But when they get inside us, of course, they drive pathology. So it's all about keeping those microbes at bay. And obviously, the frontline defenses against infection is good quality skin, good digestive system, because this physically keeps these microbes at bay. But if those defenses are broken, then or even when they're intact in the gut, for example, microbes very easily get into the bloodstream, and we need an effective immune system there to protect us from septicemia and infection. And the first most important thing is energy. Without energy, the immune system simply cannot function. Now, at rest, the brain weighs 2% of body weight, but consumes 20% of all energy generated in the body. And when the immune system is active, it is the same. When the immune system is busy fighting infection, it requires vast amounts of energy, not just to fight the infection, but also to run a fever, because we know fever kills microbes. So that's why we feel ill, and that's why we feel fatigued when we have an acute infection. And that's an important symptom. We have to rest up in order to give the immune system the energy that it needs in order to fight infection. So energy delivery mechanisms are crucial. And then, of course, good sleep. And we all know that lack of sleep is a major risk factor for all disease, dementia, cancer, and heart disease. And then, of course, we need a happy brain. And that is so important. We all need to feel safe. We all need to be within a community that is safe. We all need to have a project so that we've got something we're looking forward to all the time, which might be that holiday, that might be that visit to see our children. It might be writing a book. It might be doing our organic garden or whatever. So without having, and of course, love is so important. So what keeps me sane is my little puppy dog, my Patterdale Terrier, Nancy. So we all need this for a happy brain and a happy immune system. And then of course, good nutrition is absolutely vital. And our incredible immune systems have allowed us to survive hundreds of thousands of years of disease and danger. And given the raw materials and all else, that will continue to serve us well. So the crucial thing about diet is we need to follow an evolutionary correct diet, which is a paleo ketogenic diet, low in carbohydrates and sugars. Why is that so important? Because sugars and carbohydrates feed all infections. Very often diabetes presents with suddenly recurrent skin infections, urinary tract infections, chest infections, or whatever. Why? Because those sugars, that high sugar in the blood, exudes into our lungs, into our bladders, and feeds infection. So that is so important. And then we need some raw materials. The immune system, again, like the brain, is demanding raw materials. And the most important ones are vitamins B. Vitamin C is absolutely vital. People who die from infectious disease all die with scurvy because their vitamin C levels will be undetectable. Vitamin C are the bullets with which the immune system shoots infection. Now, what's so fascinating about humans and a few other mammals, fruit bats and guinea pigs, is they cannot make their own vitamin C. Dogs, horses, goats, cattle, they can increase their production of vitamin C in response to demand. They can make vitamin C from sugars. It's a 4-enzyme step. Humans have lost that ability. And my view is we should all be consuming at least 5 grams of vitamin C a day. That's 5,000 milligrams. The government recommended amount is 30 milligrams, which is a tiny dose. That might just stop you getting scurvy, but it's certainly not optimal for best immune and biochemical function. And then a few other supplements there, which we'll talk about in a moment. That's also important for our health and the health of the immune system is a diverse microbiome. We don't know much about the microbiome, and 90% of the immune system is gut associated. But what we do know is that the more diverse it is, the healthier you are. And to have a diverse microbiome, you need to eat a diverse diet. And a rough rule of thumb is we should be aiming to eat at least 30 different foods a week. And that includes spices and herbs, that they all count as a different food. And then, of course, free from toxins. We live in a poisoned world, whether we like it or not, we're all poisoned. How do I know that? I've done tests of toxicity for some decades now, whether that's fat biopsies or DNA adducts or translocated protein studies or whatever, and I have never seen a normal test. We are all carrying a toxic load, and all these toxins conspire to damage the immune system. So good detoxing is important. Then we have general interventions to reduce the infectious load. Now, I could take the healthiest person in the world, and if I gave them a large enough dose of, say, meningococcus, then they would get meningitis. If I could give them a large enough dose of measles virus, then they would get measles. So it's all about keeping the total infectious load down. And what achieved this par excellence before anything else came along was a good hygiene. So I think the next slide illustrates that point. So, thank you. Okay. So these are crude death rates from infectious diseases. This is the United States figures, but these will be exactly the same for this country. And what we can see is in the beginning of the, throughout history, but not throughout history, it's when people during the Industrial Revolution came to live in cities. The cities then had to deal with that vast population, and they all needed clean water and they all needed clean sewage systems, and they were simply not in place. And the death rate in children in those conditions was extremely high. If you could survive to 5 years old, then you would do very well. But many children died simply because they received an overwhelming dose of infection. And that could have been measles, mumps, rubella, whooping cough, diphtheria, etc., etc., etc. And here you can see on this graph how death rates fell when hygienic interventions were put in place, in particular good sewage and clean water. And the Victorians set up a wonderful system of clean water where the water was under pressure, and that meant microbes couldn't leak into the water pipes. And the sewage pipes were always laid underneath the water pipes so that the sewage then couldn't leak into the water. And you can see with these interventions, you can see how the crude death rate for infectious diseases decline. This is before antibiotics were introduced. And there you can see where penicillin came in 1940, but it didn't change the overall death rate much. Not that I would want to practice medicine without antibiotics these days. And then, as you can see, vaccinations came in the early 1960s. And overall, they have barely changed death rates for infectious diseases. And vaccinations have been hugely rated as protections against infectious disease. What protects us from infectious disease is good immunity and keeping the infectious load down. Okay, so these regimes which I like to put in place for people, because there's no one single intervention, it's always a package of treatment. I call these regimes Groundhog regimes because I keep coming back to these basic packages all the time. And we've touched upon Groundhog Basic. Groundhog Basic is what we should all be doing to improve our immune system in terms of energy delivery and raw materials and keep the total loading dose down. And that's a paleoketogenic diet, vitamin C, iodine, vitamin D, a good multivitamin, and all these keeping warm, fit, good sleep, sunshine, happiness. These are all the things that we should all be doing all the time to keep our immune system in tip-top shape. But of course, we're going to get coughs and colds. It's an inevitable part of being on this earth and mixing with other human beings and other things. So we will get infections. And in that event, we put in place what I call Groundhog Acute. So these are things we put in place to reduce the total infectious load. And I think the next slide, Linda, has details of Groundhog Acute. Now, always listen to your body. We have symptoms for very good reasons. Symptoms tell us when something is wrong. And what we mustn't do is symptom suppress with drugs. Oh dear, typo there. We have symptoms for very good reasons. So, for example, as I mentioned, when we are fighting an infection, that uses up a lot of energy. So don't go on a 5-mile run. Don't go to work. If you're feeling tired and exhausted, then rest up. And that allows the immune system the energy that it needs in order to fight that infection. Again, keep warm. Grandmother was right when she said, wrap up warm or you'll catch your death of cold. She said that because she had seen that happen. She saw people go out working in the fields, without proper protection. They got cold. And when we are cold, everything goes slow. When we run cold, we are immunosuppressed. We should keep warm and allow the body to run a fever. Don't take pills like paracetamol and aspirin to reduce a fever. A fever is a very good thing because heat kills all microbes. So wrap up warm. If you feel shivering, shaking, cold, go to bed, wrap up warm, run a fever. If available, have a sauna. A sauna helps to promote a temperature, helps to kill infection. That is all good. The next thing we should also do, and in fact, do this before you even start to get nasty symptoms. Take big doses of vitamin C. Now, the point here is that vitamin C contact kills all microbes, and 90% of infections come in through the mouth, either because we inhale them, they get stuck on sticky mucus, and we cough them up and swallow them, so they end in the stomach, or because we drink dirty water or we consume contaminated food. But say 90% of all infection comes in through the gut. And there isn't a time element here. The faster we can kill these infections, the quicker we will get well. Because once infections get into the body, their numbers increase exponentially. exponentially, very quick indeed. And in this event, take vitamin C 10 grams every hour. Now, that might sound like a big dose. It's meant to be a big dose. And that contact kills the microbes in the gut. Keep taking 10 grams every hour, until you get diarrhea. And again, that is very helpful to us because that physically washes out those infectious microbes that may be in the gut. And depending on what infection you have, you will need a smaller or a greater dose of vitamin C. So for normal cough or cold or sniffle, you might need 30 or 40 or 50 or 60 grams. But on the other hand, if you have Epstein-Barr virus, which is a really nasty virus, you might need 150 or 200 grams. If you have flu, you might need 100 grams. The point is, keep going until you get diarrhea, and that allows you to get ahead of the game. And at the point at which you get diarrhea, I would expect your symptoms to be abolished. Then you carry on with vitamin C at a lesser dose in order to keep those symptoms at bay and to stay well. And I've been doing this for some 30 or 40 years. And during that time, I have never had a cough or a cold that's lasted more than 24 hours. Maybe a bit of, a snotty nose that's run on for a day or two, but it's never stopped me working. It's never stopped me functioning because I take big doses of vitamin C very early on. And the other incredibly helpful intervention for any respiratory infection is to sniff iodine. Now, iodine is another one of my favorite multitasking tools, and it contact kills all microbes at 10 parts per million. So the way I do that is get yourself a salt pipe like this, and this is just a simple plastic tube full of sea salt. You can probably hear it rattling. Lugol's iodine, Lugol's iodine. So this is 15% Lugol's iodine. And you put 2 drops of Lugol's iodine in the mouthpiece of the salt pipe like that. So there's 1 drop, 2 drop, give it a little shake and sniff it. So put it to the nose, give it a good firm sniff so that you can smell it. If you can smell the iodine, you have a therapeutic dose of it. And by dint of sniffing it, you saturate the nose, the sinuses, the pharynx, the nasopharynx, the larynx, the trachea, the bronchi, and the lungs. And therefore, in those departments, you kill any microbes that may be there. And what that does is you massively reduce your loading dose. And as I say, infection is all about keeping the loading dose down so that the immune system can catch up and kill that which is left. And I now have 5 patients with chronic bronchiectasis. Now, bronchiectasis is a nasty lung infection. One is never free from infection. It's constantly present because of scar tissue there. And the normal history for those people is they go from one infection to an antibiotic, and then they're okay for a bit, and then another infection, another antibiotic until they're okay for a bit. And they run on until they end up with an MRSA, chronic infection in the lung, and then they're in real big trouble. Since putting in place all these interventions, regular vitamin C, vitamin D, paleo-ketogenic diet, and at the first hint of any symptoms in the lungs, sniffing iodine, their need for antibiotics has dropped to pretty much 0. Sometimes when they forget to do these regimes or they don't do them perfectly, then an infection gets a grip. But put all these things in place and massively reduce the infectious load. And the important reason for doing Groundhog acute is that we don't get acute infections that debilitate us and make us ill, but even more importantly, we stop infections getting into our body and driving pathology. One of the nastiest viruses you can get is Epstein-Barr virus. Epstein-Barr virus is a known carcinogen. We know it drives breast cancer, for example, and various lymphomas and leukemias. We know it drives autoimmunity. It's associated with at least 33 different autoimmune conditions. And many of the other herpes viruses are equally pernicious. Lyme disease drives other pathologies. So does syphilis. Disease drives pathology. So we can then keep these infections at bay and live to our full potential. And, I want to live to my full potential because guess what? I'm enjoying life and having a nice time. I look after an old boy who lives in my granny flat. And I feed him a paleo-ketogenic diet and all this other stuff. And in July, we will celebrate his 102nd birthday. And I'm quite sure he will make 102 because he is so well now. So all these interventions are highly effective. Okay, next slide. Okay, and remember, this is one of my favorite quotes from one of my favorite doctors. Now, Fred Klenner used vitamin C to treat a wide variety of pathologies, from pneumonia, septicemias, acute polio, chest infections, etc., etc., etc. And this is one of his aphorisms: the patient should get large doses of vitamin C in all pathological conditions while the physician ponders the diagnosis. And this emphasizes the time element. It's really important to do these things quickly. Don't hang around. Don't wait until you get symptoms. Hit it hard, hit it early, and get rid of it as fast as you can. So the next slide, please, Linda. So these are the things that we should be doing all the time to keep our immune system in tip-top form. Firstly, a paleo-ketogenic diet, because this improves energy delivery and it reduces the infectious load before you even get an infection. Vitamin C, 5 grams daily. Now, for some people, and when you get the dose of vitamin C right, you shouldn't have any gut symptoms at all. Some people need a little bit more than that. Some people need a little bit less than that. Vitamin D, 10,000 international units daily. Vitamin C is so important in our fight against infection. Lovely study looking at the vitamin D levels in COVID patients on admission to hospital. And what they found is that those patients with the lowest levels of vitamin D had the highest mortality. So if your vitamin D was much below 20 nanomoles per litre, then your risk of death from COVID was over 90%. If your level of vitamin D was above 75, then your risk of death of COVID was less than 10%. And they drew a straight line graph which went through the x-axis at about 125 micrograms, 125 level nanomoles of vitamin D. And the point here is you can achieve that easily with 10,000 IU of vitamin D daily. That's equivalent to about an hour of sunshine. If you have a darker skins, then probably a little bit more sunshine. And that's why it's so important for people with dark skins from India, the subcontinent, or Africa to take vitamin D daily, because they don't make it efficiently from sunshine. And then finally, iodine. We are all iodine deficient. Very few of us have iodine sufficiency. And my view is we should all be taking Lugol's iodine, 3 drops in a glass of water, last thing at night. Now, take iodine away from vitamin C, because vitamin C is an oxidizing agent and iodine is a reducing agent, and they knock each other out. And finally, stay happy and stay warm. And if you put all those things in place, you can live to your full potential. So that's the end of my talk, Linda. I do hope you've got some questions for me on any of those issues.
I do. Thank you very much. So we hear a lot about the ketogenic diet and its advantages in starving cancer cells, for example, of their fuel, which is sugar. So how does the paleo ketogenic diet differ?
Well, it's ketogenic because it's low in sugars and carbohydrates, obviously.
Mm-hmm.
Paleo means that we cut out the gluten, grains, and dairy products, because these are not evolutionary correct foods. We can, some people can tolerate some of them, but they came into our diet very recently. And we see so much pathology driven by allergy, and allergy to gluten, grains, and allergy to dairy products is extremely common. And then in addition to that, we shouldn't be consuming dairy products after childhood, because dairy products are there. All mammals consume dairy products, in order, as babies, in order that they can grow quickly. And that, of course, allows them to escape predation. But that means that dairy products are growth promoting, and that makes them a risk factor for cancer. Wonderful book by Jane Plant, Your Life in Your Hands. She herself had breast cancer, and by the time she'd had the radiotherapy, the chemotherapy, the surgery, there was nothing left for her, and she was left with a lump in her breast and 2 months to live. Simply by cutting out dairy products, she watched that tumor regress and shrink away, and she went on to survive many more years. So that's just one example. And of course, that doesn't work for everybody, but it's jolly nice and it works for one. But it illustrates the point: dairy products are growth promoting. And also, they have too much calcium for magnesium in them. That makes them a major risk factor for heart disease and for osteoporosis. So, and again, there's no other mammal that consumes dairy products after weaning. So if you're not allergic to dairy products, then butter is perfect. Very happy if my patients have butter and ghee because that's pure fat. The dangerous part of dairy products are the protein content and the sugar content. So for the occasional treat, perhaps, but not as an everyday staple.
And how do you stand on eating fruit? Or where do you
Well,
stand?
of course, again, whenever you have a difficult question like this,
Yeah.
always go back to our evolutionary biology. You know, how did primitive woman do this? And of course, primitive woman and primitive man had fruit, but they only had fruit for a very limited window of time, and that was called the autumn. And fruit, of course, is full of sugar and fructose, and that switches on our carbohydrate craving gene. So we'd have eaten fruit and eaten fruit and eaten fruit until we got fat. And in fact, fructose makes us lay down fat. That's one of the features of fructose. And being fat in the autumn is totally desirable for the winter survival for obvious reasons. But of course, primitive woman, that fruit ran out. It went rotten. It didn't last. And so she went back onto her ketogenic diet because she had no choice. But nowadays, of course, because of modern farming methods and supermarkets, we switch on the carbohydrate gene, we start eating sugars and carbohydrates, and we never switch it off. So we go on eating these foods throughout the year, and that's what drives pathology. So again, the occasional jolly, the occasional feast is fine, but not for everyday staples, because fruit is a bag of sugar. And of course, the fruit growers themselves know this. They know that sugar is addictive. And so the modern strains of fruit are getting sweeter and sweeter and sweeter. So primitive woman's idea of an apple would have been a crab apple. Well, guess what? I can't eat many of those without getting bellyache. Berries are probably acceptable because they're low in sugars, but not all the time and not in big doses.
So for someone who's new to this kind of diet, what would you recommend for a transition from standard diet to this sort of diet?
Well, I mean, in order to persuade people to do these diets, I have to give them the intellectual imperative. They have to understand, why they have to make the change. And the first thing I ask people to do is to recognize that sugars and carbohydrates are addictive and we eat them in an addictive way. I can tell you the sugar addicts from the first few foods that go into their mouth, because when overnight we fast, of course, we're not eating, and we wake up in the morning, and if breakfast is cereals, porridge, fruit juice, toast, bread, sweet tea or coffee, then almost certainly they're sugar addicts, they're carbohydrate addicts. And this spikes blood sugar levels. Spiking blood sugar levels spikes insulin, and that lays down fat. And then the blood sugar comes down and you produce adrenaline and you're hungry again. So the carbohydrate sugar addicts are snacking through the day. They have to keep going with a biscuit at 11 o'clock and a sandwich at lunchtime and so on. One of the joys of doing a ketogenic diet is you don't run out of fuel. Now, you might get a bit rumbly in the tummy, but if you ignore that, it passes. But if you really ask yourself, is the brain working well? Oh, actually, yes, it's working fine. Have I got energy? Do you think? Well, yes, actually, I have. You can miss a meal absolutely without, running out of energy. And the next step, once you've established a paleo-ketogenic diet, is to do time-restricted eating. Did primitive woman get 3 meals a day? No, she didn't. And these days, I try to consume all my foods within a 6-hour window of time. So lunch at 1, supper at 6. Okay, it doesn't happen every day, but most of the time. Ahmed Malik, who's a lovely doctor who developed type 2 diabetes, when he did a ketogenic diet, he then went to consuming food just once a day. He just has 1 meal a day, and guess what? He doesn't run out of energy. He works hard, he runs every day, he's looking after children. So we think we need that hit of sugar for energy, but it's not so. And once people recognize that and realize it, then they feel so much better because they're not running on sugars and carbs with uppers and downers. They sleep better because wobbly blood sugars disturbs sleep. And very often they find their foggy brain has gone. They're much sharper. They can think more clearly. So I use those things to persuade people to do the diet. Expect to get keto flu. Expect to get withdrawal symptoms. And guess what? That's symptomatic of being an addict, isn't it? Now, all addicts get withdrawal symptoms when they give up their coffee or their nicotine or their alcohol or whatever. And it's the same with sugar. And welcome that as a good sign that you're doing the right thing. And then once you get that feeling of wellness, once you're keto adapted, write it down, make a note of it, because we forget the change. And we go and say, oh, I just fancy a biscuit. Oh, I just fancy a bit of chocolate. And suddenly you're back on that addictive joyride again.
How long does it take until you are adapted? Is that very unique? Or
No, quite quickly. Certainly within a week, and certainly within 2 weeks.
Right.
Now,
Okay.
that's a very, very good question, because another extremely common problem is the underactive thyroid. And normally when we get into ketosis, we fat burn with thyroid hormones. Now, if you are underactive and the thyroid hormones are not working well, then you fat burn with adrenaline instead. And that is a horrible, uncomfortable feeling. It gives you that wired but tired feeling, as I call it. There's a name for it. It's called ketogenic hypoglycemia, dreadful name. But the point is, it's a useful clue to think thyroid.
Right. Okay. Is there a good time of the day when to take supplements, like vitamin D, for example? Would you take them all in the morning or in the evening, or spread out through the day? Or
It's not critical. They're probably better
Right.
absorbed on an empty stomach. So
Right.
I tend to take most of my supplements in the morning in one fell swoop. The only thing you need to separate is the vitamin C and the iodine.
Iodine,
So I have a pot of iodine that sits next to my toothbrush. So I do my teeth, and then, mustn't forget the iodine. So 3 drops of iodine last thing at night. And again, that helps to sterilize the upper gut. If there's any infections around, it'll knock those back. It's incredibly helpful. I mean, throughout this whole COVID nonsense, I think I had one day when, I think, I know I wasn't right, but the next day I was right as rain. And around me, my secretaries, my friends who weren't doing all this, they're all going down with COVID and being ill for a week. So, I'm perhaps I'm being smug and fat-headed about this, but the point is, I know it works.
Yeah.
And, I encourage my patients to do it, and they tell me they know it works too. You've just got to do it.
Some holistic practitioners stress the role of chronic fungal infections and also parasitic infections in impaired immune health. Do these aspects feature in your approach at all, or is that something
Well, of
that's
course.
yeah?
Of course. You see,
Yeah.
by the time people come and see me, they don't come and see. I mean, I've never had an 18-year-old come and see me and say, look, I'm completely fit and well, and I want to live to 100. It's never happened. And guess what? It's never going to happen. People come to me when they're sick. And as I say, most illness has an infectious driver. In fact, I might go as far as say all illness has an infectious driver. And we need to keep that infectious load to a minimum. Now, many of these infections, they start off in the gut. Now, if you are eating a sugar and a carbohydrate-based diet, you will overwhelm the ability of the upper gut to be sterile. Now, our stomach should be near sterile. And what allows that to happen is stomach acid. Stomach acid is so important. It is a frontline defense against infection. If we destroy stomach acid because we're eating sugars and carbohydrates and we've got a fermenting gut, or we're taking drugs like omeprazole, we open up the floodgates. We allow all these infections into our body, and then it's much harder to get rid of them. And yeast infection is very common. Yeast overload and maybe parasites in the gut. And they get in there because we no longer have an acid stomach. And we no longer have an acid stomach because if we're eating sugars and carbohydrates, we're feeding fermenters in the upper gut, and those fermenters line the lining of the gut, give you a leaky gut, so acid can no longer be concentrated in the upper gut. And a very, very common fermenter is yeast. Now, primitive woman's immune system knew that yeast was a common fermenter because, and how do we know that? Because we have because when you have a fermenting gut by yeast, yeast ferments sugar to produce alcohol. We all know that, don't we? That's basic, simple chemistry. And alcohol then has to go to the liver to be detoxified. Now, humans have evolved an enzyme in the liver called gamma GT, which is specific for alcohol. It only does alcohol. And we need that enzyme to deal with the alcohol that we get from fermenting fruit in the gut during that autumn bonanza. So that's it. So we've been faced with yeast infections, yeast overgrowth of the gut for hundreds of thousands of years, and we have the biochemistry to deal with it. So what that tells us is that yeast is a common upper gut fermenter, and yeast does get from the gut into the bloodstream where it drives all pathology. In fact, there's a lovely book that I recommend you read by Mark Lintern called The Cancer Resolution or The Cancer Resolution. And he develops a very powerful argument that suggests that all cancer is driven by fungi. Now, I can't give you this lecture in 2.5 minutes, but read the book. It makes perfect sense. So let's start fighting cancer by stopping yeast getting in there in the first place. And we do that by looking after our upper gut, make sure we've got a nice acid upper gut. And we do that by eating a ketogenic diet. So all roads lead to Rome.
And once you have parasites in your gut, how do you get rid of them? Do you get rid of them with the diet, of course, but also through vitamin C or iodine? Does that,
yeah, you can clean up the upper fermenting gut in a few days by first of all stop feeding them. Remember, they can only run on sugars and carbohydrates, so ketogenic diet, maybe time restricted evening, maybe even a fast. And then you kill them with vitamin C. So vitamin C on the empty stomach will contact kill all microbes. Last thing at the end of the day, iodine. 3 drops of iodine will contact kill all microbes. So that massively reduces the fermenting and the infectious load from the gut. Now, of course, we do need microbes in our large bowel. That's the last 5 foot of bowel. So the first 20 odd foot of bowel should be sterile or near sterile. And we achieve that, say, with the duck. The last 5 foot of gut where our microbiome is, that's what we want to look after. Now, those microbes in there, they don't ferment sugars and carbohydrates. They ferment fiber. So we want lots of fiber in our food, soluble fiber, and we want as diverse a diet as we can because there's lots of different microbes there, and the diversity will be fair to say by lots of different foods. So nice, diverse diet, 30 different foods a week we should aim for.
One question I want to ask you is, I had a little discussion with a colleague a few weeks ago, and we were talking about how best to nip a cold in the bud. And I mentioned your vitamin C and so on. And his take was, well, it's actually better. Perhaps it's better to let the cold run its course because the body wants to rid itself of toxins. And I know some practitioners do have this sort of approach. So it's basically saying if you get a cold, just let it run its course because your body wants to. You don't think that?
I absolutely don't buy that. We've got lots of very good ways of detoxifying. Now, the largest toxic load in the body comes in through our mouth when we eat food. And it's toxic if we eat the wrong food, processed foods, processed fats, sugars. And it's toxic because when we have got a fermenting gut, we ferment to produce a whole heap of toxins. Now, we've touched on ethyl alcohol, which is what yeast ferments sugar to. But if you're fermenting in the upper gut, you will be producing maybe methyl alcohol, propyl alcohol, butyl alcohol. You'll be producing hydrogen sulfide, ammoniacal compounds, D-lactate, a whole heap of toxins. And then the microbes themselves, which are fermenting, they produce their own toxin. So bacteria produce bacterial endotoxin. Yeast produce fungal mycotoxins. And these all have to be dealt with by the liver. So the biggest single thing you can do to reduce your toxic load is to eat a paleo ketogenic diet. That's number one.
Right.
And then we have, of course, vitamin C. Taking lots of vitamin C and iodine, they're also metal chelators. They help strip out toxic metals. They improve our antioxidant status. And then we should all be eating, ideally, an organic diet. So don't use an infection to get rid of toxins. I just don't buy that at all. You actually, by not treating the infection, quickly and effectively, you are increasing your toxic load because all those viruses and bacteria, they are toxic and they produce their own toxins. So I just don't buy that argument at all.
Okay. Lastly, given that the GMC has failed so miserably in protecting doctors and patients, any thoughts on creating a new system of accrediting doctors and whether this is something that WCH British Isles will be taking on?
Yes, I think this would be a fantastic project to take on because let's face it, the best judge of a doctor is the patient. Because the patient can see how that doctor works, whether they get better, if they are improved or not. So we should all be judged by our patients, by our clients. And guess what? That's how, all other professions are judged. There's a wonderful website called is it called Find a Plumber, or I can't remember what it is now. It's where if a handyman or a plumber wants to
Mm.
prevent themselves, then they get on the website and they get
Mm.
feedback from the clients who have.
Checker
We
trade, I think is it
Yes,
is.
a checker trade.
Checker
Thank you
trade,
very
yes.
much. Checker. Now, we need an identical system like that for doctors. And as we speak, I'm in throes of setting that up. It's an early stage. It's called Freedom Health Connect. But the
Fantastic.
idea here is that doctors will join this Freedom Health Connect. And by joining, they have to reaffirm the Hippocratic Oath. That is to say, everything that they do will be for the benefit of that person sitting in front of them. They will treat that patient, that person, as if they were a brother or a sister or a member of the family. And the second thing they have to promise is that they have no vested interest in any of the treatments that they recommend, because so many doctors get paybacks for recommending tests, or they get kickbacks for recommending drugs or even nutritional supplements. And that is wrong. We should have the patient's best interest, at the front. And in exchange for that, the patient can then obviously access these doctors who have reaffirmed the Hippocratic Oath. And then every doctor will have a reputation page. So, and if I have a consultation with you, for example, then you will be given a code and you can write what you like on my reputation page. And if you think I'm a rotten doctor, you can write that. But if you think, yep, she was helpful, really good value for money, and I got better, then you write that in the reputation page so other people can come along and see that. And if we can drive that through with World Council for Health, then I think that'd be a wonderful thing, because that will supplant the GMC and all these other regulatory bodies. Because we know with regulatory bodies, they all become self-serving. In fact, the General Medical Council is the oldest regulatory body in the world. It was established in 1858. And at one of my hearings, when I attend these hearings, I defend myself. And of course, the GMC hate that because I'm gobby. And at one of these hearings, I said, I have to say, if the GMC was my patient and I was its doctor, I would diagnose senile dementia. Now, I thought this was a terrific joke and laughed like mad, but the GMC didn't think it was very funny at all.
Fantastic. Okay. Well, thank you so much, Dr. Myhill, for sharing your expertise and your time. And it's been a privilege speaking with you. And I hope we can speak again soon sometime.
My pleasure.
Okay. Thank you so
Thank you,
much.
Linda. Thank you.
Bye.
Bye-bye.